staff from across a broad range of disciplines, including OTs, physios, clinical nurse specialists, advanced nurse practitioners, discharge coordinators, NCHDs, etc. Just came together in an absolutely wonderful way, all guided by the same principles around managing a change project through the Lean Six Sigma program. Achieving results in relation to significant number of the delayed discharges, reducing their length of stay, targeting various, the project targeted various parameters in that patient journey. Patients waiting greater than 30 days, patients waiting from the 7 to 14 days, looking at each of those, taking measurements, taking snapshots, looking at what is happening around those specific performance indicators, and each of the team members got their opportunity to inquire into their own practice, inquire into each other's practices, just sort of laid it bare in a blurring of the boundary way, and from an integration perspective. We had the full support of the RCSI hospital group as well, so hopefully this project will be able to, not just will Connolly benefit, but it'll be the RCSI hospital group hospitals.
So one of the reasons we were so keen to become involved in the Lean project was because, reflecting on the data recently from Connolly Hospital, we really were struggling with our delayed discharges. In truth, or beyond 30 days, those people in the hospital beyond 30 days, the bed day usage was considerable. And I suppose what it allowed us to do was to come together as a group, multiple people from different areas within the hospital, sit down and first of all reflect on where we were, what perhaps we could improve upon, and then using the Lean process, divide up into different teams to target different issues, different delays in patients' transfers and their journey throughout the hospital. And what's been really exciting about it is that the enthusiasm from colleagues in relation to delivering on this, looking at the core issues as to why patients have been delayed throughout their journey. And I suppose overall, this is all about improving patient care. So I think it's been exciting, and we hope to reap the benefits of it. And even now in our day-to-day practice, we can see how it's embedded. Things like the huddle, things like the allowing patients to their information on admission regarding when they're going home. Different aspects to it have been very useful. And I have no doubt we'll see benefits in what I talked about, our delayed discharges and that cumulative bed day. And that's very important for the functioning of the hospital and for us to be able to have a number of patients being discharged appropriately and safely so that we can provide the bed needs for our acute patients as they enter the hospital.
So, having worked in this role for quite a while, I had recognised there was a lot of work being put into the long-term care group of patients, as was required, but that there was, I felt there was a means to improve how we were managing the group of patients that were here from 14 to 20 days, ways to get these patients identified early for supported discharge, and also identified early for rehab and for intermediate care.
A large cohort of the delayed discharge cases were older adults, and the average age being 7 to 6 years. We also found that a lot of people actually needed NDT input, and particularly physiotherapy, with 91% needing physiotherapy input. Throughout the stay, a lot of these cases declined in mobility, so we saw a huge increase from people coming in mobile into the hospital, but unfortunately by the end of the stay and the end of the delayed stay, their levels of dependency had increased. And that was in about 2/3 of cases. 67% had a greater dependency level leaving here than when they were admitted here. And I suppose one of the other things that we saw is that while it was mainly older adults, mainly with greater dependency levels, they also moved towards a lot. So about 2/3 moved towards once or more, and some cases were moving 2, 3, 4, and 5 times. So when you have a group of older adults that need considerable therapeutic input from physiotherapy, occupational therapy, speech and language therapy, and then they're moving wards often, that means they're moving multiple MDT teams, maybe once, twice, or 3 times throughout a stay. So one of the things we wanted to focus on throughout our Lean project was I suppose, why, if you move wards often, is that a salient feature of being a delayed discharge here in Connolly?
Really well, and that we're all communicating better between the teams, that we're passing on information between all the different disciplines and professions.
And I feel like the referrals they're much quicker, that we're seeing them, and they're more appropriate as well in terms of which patients we're actually seeing.
And patients are identified sooner in the morning for discharge, earlier in the day, so not 11 o'clock discharge.
I certainly find it easier because we're identifying patient pathways. So we're identifying barriers to discharge, but we're also identifying pathways. So if they go to capital, Clontarf, intermediate care, OCAT, and discharges, which is really important. So patients know they pick up the discharges at 9:15 in the morning. So patients are moved, and that was always one of our aims, to reduce the press time in ED.
And I think patients and families know as well, because there's more discussion about when the proposed discharge date is going to be. There's actually a definite date for it, which helps.
Out of discharge begins on admission. And so what we did within the lean process is that we sat down with the medical team and we looked at ways of alerting everybody to the potential complexities that patients could encounter during their process. We changed the medical proforma, the admission proforma, and we put in extra alerts that would then give us a complex alert system within the emergency department. And that followed through then to the ward. The patient was then given a predicted date of discharge, which was hugely important, because what it does is it gives us a focus on the patient journey. And we didn't have a predicted date of discharge. It wasn't in our narrative within the hospital before the lean project.
A very simple part of the lean project was that patients weren't involved in knowing when they were going to be discharged. And looking at that, we were highlighting it on the whiteboards, we were highlighting it to patient flow, however the patient wasn't involved. So what we decided as part of our project was to very simply put a small whiteboard above every bed. As you can see, your predicted date of discharge and the date underneath it. Now, this was a small change. The impact this had on patients and patients' families was incredible. On the day we introduced this, I would have taken up to 12 phone calls. So the conversation started. Sometimes it's not easy, people, wondering, well, why are you predicting? But you're having the conversation, you're explaining that this date replicates when they will be going home after their treatment. So the conversation is happening. You can see today is the 2nd of July. It is 11 o'clock. This patient has left and this bed will be filled in the next 15 minutes. So from a patient experience, it means that from the time the patient comes into ED, they now know that there is a bed available. The communication piece from the ED to patient flow, to nursing, to the medical team, it all means better patient outcomes, better communication. A really, really simple piece that I think has had a huge impact on patient care and indeed on patient safety.
So we spoke to patients and families and staff members just to inform our decision making around how we communicate with discharge. So as a result of that, we designed a suite of documents to just have people more involved in the discharge process. So the plan is that every patient coming into Connolly Hospital will be given a bright folder, a yellow folder, and within it there will be key information about the discharge process. So we will give them each a leaflet which just explains key information that they should be asking the medical team and the nursing staff to prepare them for discharge. We designed a leaflet. A lot of our therapists were saying that patients were often losing 2 or 3 days of therapy time because they didn't have appropriate clothing or footwear. So we just designed using kind of pictures and wording key items that patients and families should be bringing in. we designed, a lot of the feedback was around care plan and meeting. So in research that we conducted in Connolly Hospital, we found that 49% of our patients who were here over 14 days hadn't had a care plan and meeting. So if they had it, there wasn't always a structure around it, and the documentation of meetings varied from patient to patient and ward to ward. So we designed an information leaflet for patients that would explain why we hold care plan and meetings, why we would like them to be involved in the process, and what feedback they should expect to hear from teams.
In our solarium, where we have actually renovated in the last year and a half. In the past it was just a meeting room. However, we got funding and we decided that it would be a lovely space for patients, as we've done a lot of changes around our environment, which is all very well and good, because a lot of our patients do have cognitive impairment, dementia, stroke patients who would have delirium. A lot have, they cannot walk, they're confined in wheelchairs. So Ger actually came up with a brilliant idea as part of a course she was doing, and she might like to talk a little bit about that.
So the course was part of the Dementia Champion, and for my project I decided to develop a meet and eat. So there was, what it entails is patients, about 6 to 8 patients would come down, have their lunch here once a week, and let them socialise with staff, with themselves, and just getting them away from the bedside. As in hospital, the bedside is very isolated. Mealtime is task driven. So by doing this project, it was just getting the patients out of the room, let them see, like, you know, outside, just even to see outside, sitting at the table, bring them back to normally, just chatting with each other, a little bit of music on, and just bringing it back to home, and just something for them to look forward to, and just to socialise with.
And I suppose, again, we are in an acute setting, so a lot of this was met with a lot of resistance, because, you know, again, as Ger said, it's all task driven, and Lisa will agree with me on this. You know, you put the meals in front of the patients, you take the meals away, there's no really social interaction other than, you know, handing out the trays, but bringing patients down. Now that did entail, because it's a really busy, very acute ward, buy-in from our key stakeholders, and the stakeholders in this were everybody from an MDT. Indeed, Lisa was a great advocate for bringing patients down. And I don't know, do you think it makes a difference, Lisa?
Huge difference, absolutely 100%, because when the patients come down, they're actually sitting and they're talking and they're saying, oh, who's this, who's that? And they're actually we have games as well that we provide for them if they're in the humour to do it or whatever. But it's a huge difference, and the communication just flows so well.
It's been a marvellous success. The intake of food has risen, and the social interaction is absolutely marvellous, with over 50% of the patients enjoying their daily lunchtime.
Discharge is a really important part of the support I give to student nurses. It's really important that we communicate well with our patients, we plan for discharge well in advance, that we make appropriate discharge letters to the public health nurses, and that they're clear and concise, so that the public health nurse is really aware of what has happened in the patient's journey in regard to nursing.
It was our old system that we used to practice, where we used to have numbers written on the board, and we have old paperwork that was there. But after the Lean project was introduced, this is the clipboard that we got, and there it is all specifically, and with looking at it, we know where we are. Like, for example, you're looking for phone numbers, you have it there. It's all, you don't have to spend too much time on it. But especially our ward being a respiratory ward, we have, how to order oxygen, where to go, for which particular area. Everything is there right in front of you, so it is definitely very, very easy for staff to find it. Especially, another thing that I can show you here is the fair deal, the process of fair deal, which it is so simplified and written there, which is like, step by step what is being done, which is brilliant. Like, every staff, every healthcare worker who's looking at it will be easily able to find it. And also this is a process of our CSARS form, where everyone, the social workers part, the nurses part, everyone's part is written there. At least when they go through the paperwork, it's made very easy.
Woodlands unit was opened in January. It's a 20-bedded unit, and initially it was started off as sort of a waiting area for people waiting for long-term care. Now we take them directly from ED. It's a quieter environment. The patients love it. As you can see, there's beautiful gardens. So this is our end-of-life room. Predominantly we're taking patients from the emergency department who otherwise would die on a trolley. It's a really peaceful. Families that have used the room have really liked it. It's peaceful, it's what every hospital needs.
From a bed management and patient flow point of view, the results over the last 3 months have been significant. We've gone from regular black escalation to bringing down our full capacity trolleys to closing our surge areas and having spare beds at the end of the day. And this, you know, the multidisciplinary team working together, good working relationships, all comes down to the one thing that is the most important, which is the patient. They're getting discharged more timely, which also gives them access to beds from ED in a more timely fashion.
I think having people from the different disciplines actually bringing a different viewpoint or vantage point of the wider picture was very interesting. And from a physiotherapy point of view, I think it was great to have involvement. It kind of got us all thinking a little bit more about our own role that we play as a team member on the wards and how we get someone home and how we get them home safely and timely.
The LEAD project has ensured that our patients get through our emergency department much quicker. Our trolley car figures are down on last year and our year on year. Our 93% of 9-hour PET target has been reached. And so 6-hour PET at 73%, which is much improved on last year. It means our patients get through our emergency department much quicker in a more timely and streamlined fashion, and it's benefits for patients and staff.
Last Friday we had 39 vacant beds going into for the weekend.
The LEAN project has enabled teams to work together in a multidisciplinary way using a framework, the LEAN methodology, to capture issues that are problematic in promoting earlier discharge for patients. This project now means that every step of the patient's journey is considered.
So the LEAN project has made a huge difference to Connolly Hospital, to all our ability to get our patients discharged in a much more timely fashion. It's also enhanced our own relationships within the hospital.